Our special guest today is Dr. Aneesh Singhal. He is a board certified physician and neurologist at Mass General Hospital and Harvard Medical School. We are going to talk to him today about strokes. Aneesh, thank you very much for your time.
Good evening, Mr. Mishra. It's my pleasure to be here.
We are going to start with stroke. What stroke is, if you can just explain to us.
Well, first of all, thank you for emphasizing stroke in your fantastic health expo and on your website, and thank you for everything you do for the Indian community in New India. Stroke is the equivalent of a heart attack. It's a vascular condition that affects the brain. Worldwide, it is the leading cause of disability. It's the leading cause of death in certain countries. In the United States, it's the fourth or fifth leading cause of death. It's a very common condition. In the United States, about 800,000 people get a stroke every year. About 150,000 people die of a stroke every year. To put it another way, to emphasize how common it is, every 40 seconds, someone gets a stroke in this country. Every 4 minutes, someone dies of a stroke in this country. In summary, it's very common. The stroke occurs because of blockage of brain arteries. That accounts for about 4 out of every 5 strokes. In 1 of 5 strokes, a stroke occurs because of rupture of the brain arteries. And you might be familiar with the term aneurysm of the brain, so that's one type of stroke. Arteries can also rupture into the brain. That's just called lobar or parenchymal hemorrhage. The clotting type of stroke is the most common, more than 80% of all strokes. And that occurs either because of a clot traveling into the brain and blocking the artery and causing damage to certain parts of the brain, or because of clotting occurring inside the artery by itself, and rarely it also can affect the veins. So that in a nutshell is stroke. There are many causes, many risk factors, many ways to prevent stroke. I'm sure you'll be interested in learning more about that.
Well, first thing we want to find out, what are some of the symptoms of stroke, like before it happens?
Yeah. There are what we recognize as the cardinal symptoms of stroke. What you ought to remember is that stroke happens suddenly. Mm-hmm. When a clot goes up or the artery ruptures, it causes sudden onset of symptoms. So you can get, the most common symptom would be weakness of the face, arm or leg, or all three together. You can also develop numbness or sensory loss of the face, arm or leg of one side of the body or the other. Double vision, loss of vision, sudden onset of headache, trouble speaking or understanding, trouble walking, trouble controlling your arm movements. Anything that starts suddenly could be the symptom of a stroke.
And what is the time lag between the symptoms and having actual stroke?
That's a great question, actually. I don't think we know the true answer, but we believe that it's simultaneous. The brain can't tolerate the absence of blood flow or oxygen or glucose, whatever the blood is carrying to the brain cell. So the minute there's any interruption, you develop a symptom.
So, for example, it's not like in other diseases we can see that, for example, you get a diabetes and you go to bathroom frequently and all the signs.
Yeah.
In this one, there is no such long warning.
And in fact, only about 10% of all stroke patients develop a warning symptom, which could be, a couple of seconds or maybe a couple of minutes of arm or leg weakness or double vision that goes away. You think that, you're not even sure what happened, and that's called a transient stroke or a transient ischemic attack or a TIA. That could be the warning of a stroke that's
So if we see these type of symptoms, like suddenly we lose, as you described, what should be the first step we should do?
The first thing you should do is ask yourself, well, something has happened suddenly. Could this be a stroke? What you need to do is pick up the phone, call 911. The paramedics, we've trained them across the Northeast and in fact across the entire country. They're very familiar with the voice on the phone saying, I think I'm having a stroke. That's all you need to say. The system kicks in, the paramedics will come, they have bedside tools to evaluate and confirm or not whether you're having a stroke. They will transport you to the closest stroke certified hospital, and the sooner you reach, the better your chances for getting treatment. And studies have shown that if you reach within 3 hours, the chances of improving after a stroke are much higher. So what you need to do is go to the hospital quickly, to the emergency department, and the system will take care of the rest.
What about the disability, for example? If you recover, what are the chances of people being disabled?
Yeah, stroke, as I said, is the leading cause of disability worldwide, and stroke's a common condition. In fact, because of the chronic long-term disability, it costs in the United States $36 billion to take care of patients with stroke. The disability can be variable. Some patients recover with no symptoms and have no disability, and then they have mild disability to very chronic and very debilitating illnesses such as hemiplegia, where you can't move your right arm or leg or your left arm or leg, or you can't speak or you can't see, and you're left in a nursing home where you need constant supervision. So there's a big range of disability.
So is it reversible or no, the stroke?
It can be. Rarely it is spontaneously reversible. But nowadays we have great advances in treatment, which can be given in the first few minutes to hours after a stroke. And with those treatments, the reversibility component has more than tripled, almost tenfold in some cases. So it can be treated and reversed in certain cases.
So if you can also tell us the difference or similarities between heart attack and stroke.
In the broad sense, it's kind of the same mechanism. What we're dealing with is a sudden onset of a blocked artery. If that artery is in the heart, we call it a heart attack. If the artery happens to be in the brain, we call it a brain attack or a stroke. So that's the fundamental difference.
Yeah.
The other difference, of course, is that heart attack causes pain. So people feel the chest pain. It's widely recognized. It's advertised in every movie, for example, the symptoms of a heart attack. So people know about it. Because of the pain, because of wide awareness, you're more likely to pick up the phone and call 911. Stroke can be silent. Most often there's no pain. You'll get a symptom. People are not aware. They don't know what it is. They don't call 911. That's another big societal difference between heart attacks and stroke.
We'll come back to stroke again, but before I want to ask you that how did you get interested in neurology and strokes?
Well, neurology, my interest germinated during my training at the King Edward Memorial Hospital in Bombay. That's where I trained until 1995. And then I did my internal medicine residency before coming here. During the course of my medical school training and internal medicine training, I saw a lot of stroke patients in India. And, I just became
Which is not very, when I was growing up, I hardly, hear that somebody got a stroke.
Yeah. It's common. And I was attracted to neurology in general, just because of how fascinating a field it is. And then when I started seeing stroke patients, I became much more interested. I came here, I matched at Mass General to do neurology training. MGH happens to be the world's leading stroke center, and we have a lot of very interesting stroke cases with a lot of in-depth examination, and it was the most fascinating field at the time, and it still is, of course. A second reason, of course, is that treatments for stroke were evolving when I got onto the scene. So it became not only an attractive field because of how interesting it is, how it gives you insights into the function and dysfunction of the brain, but also it was one of the rare neurological conditions which could actually be treated. And there was a sense of urgency, there was an emergency department, a lot of action in the field. So I was naturally affected.
So now the brain is one which is a very interesting topic to talk about, whether you were in meditation or whatever, everything comes to brain. So now for a minute, if I ask you that, take your physician's hat off and just talk as a philosopher who knows the brain, how the brain works.
I'll try.
What do you think about brain?
Well, it's certainly a complex organ. It is the most fundamental and most vital organ. The whole reason you're a human being is because you have a brain and you have thought.
Yeah.
Right?
So now, can the brain be controlled? Can we do something that the brain doesn't drive us crazy, either by thinking process or by whatever it is? Is there any way that we can control the brain?
Well, that's a hard question to answer as a neurologist, but I would say that yoga, meditation, these types of things can, you can control moods, You can control what you're thinking about. The environmental exposures can change the direction of where you're thinking or where you want to be.
Mhm.
So in that sense, yes. But a stroke is, for example, one way where you can suddenly change the human being, the whole character, right?
Have you come across any case where you thought that this case is totally hopeless, and then it has come back? I said it has
I
surprised you.
tell you, it's not just an artifact of being mass gendered. I think it's happening the world over, where we're actually seeing miracles happen day in and day out. I've seen patients who come in, young people. By the way, stroke can affect young individuals. In fact, 15% of all strokes occur in people below the age of 45, including children. So no one is immune from
So,
it.
like, what do you mean? Like 10, 15-year-old kids
Yeah,
can have
yeah,
stroke.
Exactly. Even newborns can develop stroke. So I've seen people come in literally in a coma, sudden onset. They're walking along, or they're sitting at home watching TV. Suddenly they lose function of the arm and leg. They can't speak. They slip into a coma. By stroke of luck, someone happens to be there, and they come into the hospital within minutes or hours, within the time window where we can actually treat them. And with these advanced treatments, I've seen people who would be in the grave walk out of the hospital the next day. I think that's nothing short of a miracle.
Sure. How we can avoid stroke? Is there anything we can do?
Yeah. So if you think about it, the arteries get blocked and there's a clot forming somewhere. So our job is to prevent the arteries from hardening and developing clots, and to prevent certain conditions like diabetes, high cholesterol, blood pressure, which is the most common cause of stroke. We need to control that. Things like obesity, smoking, excessive alcohol intake, drug abuse, these are all what we call avoidable or modifiable risk factors for stroke.
So, what is excessive alcohol intake, for example, in your?
I think studies have shown that having up to 2 drinks a day, if you do drink, up to 2 drinks, is somewhat protective against a stroke. More than 2 drinks is considered a risk factor for stroke.
2 drinks a day.
2 drinks a day, preferably red wine. We don't recommend that you pick up the bottle and start drinking if you're not accustomed to alcohol. But if you do drink, it's better that you drink 2 glasses of red wine maximum per day.
What about diet? Does diet have anything to do with stroke? Or?
It does. I think high-fat diet, red meats, these are all considered diets that increase the risk for stroke. I've just returned from Nashville, where we had the International Stroke Conference. One of my friends has published that Mediterranean diet can reduce the risk of stroke by about 18%. So different diets do increase or decrease the risk.
Sure.
The Indian diet, I think with a lot of ghee and butter, I think should be avoided. We need to control that. We do have a lot of spinach, palak and other things, and fruits and vegetables. So that can be protective against stroke.
Now, talking about the Indian diet, and now how is there any demographics study which tracks down what is happening with the Asians or Indians? Or
That's a great question. Leading up, I tried looking into this. There's no data about stroke in Indian Americans. There is some data about heart attacks, but not much about strokes. And that's something that I would like to do in the future. What I'm doing right now is a project in India, in government hospitals, and we've collected for the first time very high quality data across the country, more than 2,000 patients, and we're comparing that to the profile of stroke over here. So for the first time, we'll have high level data which will allow us to compare the differences in stroke between Indians in India and the Western population. The next step would be to collect data on Indian strokes in America and see what the differences are between non-Indians in America and Indians in India.
with your experience, like seeing all these patients, what is your just guess, if I ask you a wild guess?
My sense is that the pattern of strokes in Indians is going to be different from that of the Western population. It's going to be similar between Indians in America and Indians in India. The most common cause of stroke is because of hardening and blockage of the arteries inside the head. Westerners get carotid artery blockages in the neck. Indians and Asian people more often get blockages inside the head, which is somewhat more difficult to treat. The There are certain diseases of the heart that can also cause a stroke, because when the heart starts malfunctioning, it doesn't pump enough blood, and when that happens, you get clots in the heart. And those clots can go up to the brain, block an artery, and cause a stroke. So there are differences in the types of heart conditions that can cause a stroke between Americans and Indians.
Now, off the camera, you were giving us some very interesting data and numbers. Can you talk about like how many Americans get affected with a stroke? And
Sure. I think it's a little less than 1 million. About 800,000 Americans get a stroke every single year, of whom about 130 to 140,000 die of a stroke. So that works out to one new stroke every 40 seconds and a stroke-related death every 4 minutes. So that's quite substantial. There are differences amongst the race and ethnic groups that we know of between blacks and whites. I think the risk is twofold higher in blacks than in whites.
what may be the reason? Is the
I think it's
education?
it may be partly genetics, but I think it's quite a bit environmental. Things like untreated hypertension, diabetes, obesity, physical inactivity. There may be ethnic social differences between the two groups that explains this.
So stress, of course, is a factor in various diseases, and I think since stress has to do with the brain, it might have some impact on.
Well, that's a good question. It's very difficult to quantify stress and really pinpoint why and how it might contribute to stroke. But I do agree that there may be an indirect effect of stress by, for example, raising blood pressure or worsening headache disorders such as migraine, which rarely can cause a stroke, or worsening diabetes. People under stress may forget to take their medicine. So there may be indirect consequences of stress that can contribute to a stroke. But by itself, stress is not regarded as a major risk factor for stroke.
Now, earlier you were giving us some numbers and data about a stroke. Do you have any number for heart attack, something similar?
Well, heart attacks are much more common. I'm not the expert on heart attack,
Okay.
but heart attacks itself are much more common. But you've got to remember that a lot of these heart attacks, they don't cause an outward disability. Right? There's a weakening of the heart muscle. Heart attacks can, of course, be fatal. They can cause weakening and heart failure and other problems. Strokes are different, although less common than heart attacks. They can leave you with long-term disability. I mean, you imagine life for 20 years not being able to speak, or not being able to see or move. You're stuck in the bed. So that's the difference between heart attack and stroke.
Any interesting case you can talk to us about without mentioning the name?
Sure. The interest, I think what might be impactful is the treatment and the outcome being good. So I'll tell you this example. He's a young man whom I'm familiar with because every time I go to the airport, he's one of the screeners, the baggage handlers over there. So he came into the ED with 15 to 20 minutes worth of trouble articulating his words because of tongue weakness and slight facial weakness. So he was sitting there. The ED called us down saying, could this be a stroke?
And what is ED? Like
Emergency department.
emergency.
Sorry.
Okay, sure.
In front of my eyes, this man said, I'm not able to speak. And then he said, I can't see. And I could see his eyes crossing. I could see his face becoming more weak. He couldn't move his arm, his leg, and he lay down in bed. He was unconscious in a matter of 5 or 10 seconds. So we acted promptly. This was a stroke happening in front of our eyes. We took him directly to the CAT scanner, CT scan of the head, which is the standard test to rule in, rule out stroke. We saw that there was not much brain damage, that there was an obvious clot sitting there. We took him out of the scanner, gave him a drug called TPA. This is a drug that's been approved by the FDA. TPA stands for Tissue Plasminogen Activator. What it does is it lyses the clot. So we could see the clot, we gave the drug, the clot started lysing, but the patient still hadn't woken up. Today we have a second treatment where we can insert a catheter into the groin, put the catheter up into the brain, entrap the clot and pull it out. So we did that. And this man, in about 3 hours when he came out of the operating room after the procedure, was awake, talking and walking. He went home the next day and he still works at Logan airport.
And no symptoms of...
No symptoms at all. So he had a clot in the basilar artery, and the reason he had the clot is that he had a tear in the artery at the back, which was, I think, because he was lifting up bags or heavy weights. So when you bear down, rarely you can tear the artery. When the artery tears, you can get a clot. So we fixed the tear, we took out the clot, we sent him home the next day. And this was a man who would have died in minutes had we not intervened. So it's a memorable
Now,
case.
tell us a little bit more about this clot, how the clot can start anywhere in the body and it can reach the brain, or how does it work?
Well, most clots start in the heart or in the arteries in the neck. There are 4 major arteries that supply the brain. And all the clot can start inside the brain itself. There is a rare condition where clots in the leg can travel up to the brain if you have a certain congenital problem inside the heart, but that's rare. So clots just form because blood is not flowing properly, and that can happen because the heart is not pumping, it's become weak. A heart attack can result in a weak heart, or you can get an infection of the heart, or the valve can become damaged. Or you can get clots in the arteries over here, which is the most common type, because of hardening of the arteries. This is a condition that's called atherosclerosis. I'm sure you're familiar with that term. Advanced age, hypertension, diabetes, cholesterol, this can all harden the arteries. And when that happens, you can get clots forming within the hardened artery. So that's the most common cause as well. Sometimes you can get tears in the artery, you can get clots because of hematological or blood disorders and other risk factors as well.
So how important role genetics play in a stroke?
There are certain types of stroke which can be inherited. That's rare. There are more common is strokes because of hardening of the arteries, and we are now learning just over the past decade or so about the risks conferred by several genes. There's not one gene, but it's multiple genes and the interaction with the environment, things like diet and hypertension and other things, which interact with genetic predisposition to increase the risk for stroke.
So it's very sad to conclude this way. Our discussion is that so there is only way we are going to find out about a stroke if it really happens few hours before. There is no other way.
Well, there are certain things you can do. I mean, if you maintain a healthy lifestyle and control your blood pressure and take care of your diabetes, you're less likely to get a stroke. There are certain screening tools like carotid ultrasound where you can look at the flow in the arteries, but that's not cost effective to do for the general population. So if you're at high risk, we send you for that, but otherwise we don't.
Aneesh, thank you very much for your
Mr.
time.
It's my pleasure.
Absolutely great
I
talking
hope
to
this
you.
was educational and
Very helpful, yes, absolutely.
Okay.
And looking forward to listening to you at the Health Expo.
My pleasure. Thank
Good
you
to
for the
meet
privilege of speaking.